The project title is Mining Health Examination Records, a graph-based approach. In this, we are going to show the records in graph-based. In this, the existing system, although electronic health records have attracted increasing research attention in the data mining and machine learning communities. To handle, to handle heterogeneity, it explores a heterogeneous graph based on health examination records called heteroher graph, where examination items in different categories are modeled as different types of nodes and their temporal relationships as links. This approach is limited to a binary classification problem, that is using alive or decased labels, and consequently unlabeled data unlabeled data classification are commonly handled via semi-supervised learning that learns from both labeled and unlabeled data, and positive and unlabeled learning, a special case of SSL that learns from positive and unlabeled data alone. Data analysis, in which an exact mining objective has not yet been set, while unlabeled for analysis, the option to store free text and incomplete dates present legal values and are not considered as data errors. Disadvantages: in this existing system, healthcare data do not consider the concern of unlabeled data. They either have expert defined low risk or control classes, simply treat non-positive cases as negative. It is not informative about the specific disease area in which a person is at risk. The proposed system: we propose a large graph-based semi-supervised learning algorithm called SHG Health, that is semi-supervised heterogeneous graph on health. We present SHG Health algorithm to handle a challenging multi-class classification problem with large large unlabeled data. A novel graph extraction mechanism is introduced for handling heterogeneity found in longitudinal health examination records. Risk predictions to classify a progressively developing situation with the majority of data unlabeled. An effective iterative algorithm is designed. The proof of convergence is given. Extensive experiments based on both real health examination datasets and synthetic datasets are performed to show the effectiveness and efficiency of our method. Health examination records are represented as a graph, especially using a modeling asymmetrical results to predict the correct data category for high risk cases has been established and verified on our real datasets and synthetic datasets. Advantages of our proposed system is: we present the SHG health algorithm to handle a challenging multi-class classification problem with substantial unlabeled cases which may or may not belong to the known classes. This work points on risk prediction based on health examination records in the presence of large unlabeled data. A novel graph extraction mechanism is introduced for handling heterogeneity found in longitudinal health examination records. The proposed graph-based semi-supervised learning algorithm, that is SHG Health, that combines the advantages from heterogeneous graph learning and Class discovery shows significant significant performance gain on a large and comprehensive real health examination data sets of 1 to 258 participants as well as synthetic datasets. The alternate titles of this project is predicting patient acuity from electronic patient records, then detecting disease genes based on semi-supervised learning and protein-protein interaction networks. The last one is positive unlabeled learning for disease gene identification. Future enhancement of this research is our future work will focus on the data synthesis for a health examination records to be included with other types of data sets such as the hospital based electronic health records and the participants living conditions. That is, example of this is diets and general exercises. By integrate data from multiple available information sources, more effective prediction could be achieved. System requirements of this research are hardware requirements are system needed is Pentium 4 2.4 GHz, hard disk needed is 40 GB, floppy drive 1.44 MB, then monitor is 15 VGA color monitor. Software requirements are operating system is Windows XP or Windows 7, coding language is .NET, IDE is Visual Studio 2010, that is Visual Studio 2010. Database requirement is SQL Server 2008. Thank you.